Go.
Hi, I'm Sheila, and this is my patient today is Sherry, and my assistant, whom is my daughter as well, is Sydney. And this is Sydney's favorite friend. This is Puffy. That's going to be joining us today. So we're here, Sherry's here today for an assessment of her respiratory system. So to start this, we're going to do some inspection of her chest, and we're going to assess her respiratory rate and her rhythm as well. Just take some nice easy breaths. And we can see she has symmetrical chest excursion. And based upon inspection, it appears that her respiratory rate is around 12 or 13. Her breathing is regular, it's not labored, and there's no use of her accessory muscles, which, can be a sign of distress. After that, we're going to look for any kind of pallor or cyanosis, which would be due to any kind of lack of oxygen. And we can see upon inspection that Sherry's lips are pink, and around her mouth as well as pink, so she is free of any sorts of signs of cyanosis. The next thing we're going to check is her perfusion to her extremities. We're going to check her capillary refill. Within normal limits is less than 3 seconds. So if I can have one of your hands, and by pressing on the nail beds, the blood does perfuse back less than 3 seconds. And on the other hand, all fingers are less than 3 seconds. We're also going to assess her toes. Her toes are warm to touch, and indeed less than 3 seconds. Great. So her capillary refill is less than 3 seconds. The next thing we're going to check is any sort of clubbing that may appear on her fingers. So upon inspection of her fingers, she is free of any signs of clubbing on this hand and as well on this hand. The next thing we are going to assess is her posterior chest percussion. And to do this, if I can have you turn a bit. And there are 9 landmarks that we're going to percuss on the back. I'm going to start at the top. This is number 7. Great. The next thing we're going to check is her posterior chest tactile firmness. To do this, Sherry, I'm going to have you say 99, and you're going to feel the palm of my hand against you. For this particular assessment, there are 5 landmarks on the posterior chest. Can you say 99?
99,
And we should feel equal vibrations again.
99, 99, 99, 99, 99,
And the vibrations are getting less and
99.
less, but they are symmetrical,
99,
and now they are absent,
99, 99,
which is within normal limits for that. The next thing we're going to check is for any kind of posterior chest crepitus. Crepitus is something that would feel like Rice Krispies, and you can feel this upon palpitation. So using those 5 landmarks as well, we're going to palpate the posterior chest. And this appears to be normal. No sign of Rice Krispies. And then the next thing we're going to do is check the posterior respiratory excursion. To do that, it takes a series of steps, and thank you, Sydney. Sherry, what I'm going to have you do is I want you to take a big exhale and hold your breath for me. Ready? Exhale. And I'm going to percuss down the clavicular line. And when the sound changes, there, I'm going to mark that spot. Now I want you to take a big deep deep breath in for me and hold it. Go ahead. And we're as well going to percuss down this line, and when the sound changes, we are going to mark that spot. Great. And then just need to grab one more thing to do the other side. And again, Sherry, we're going to do the same thing. Exhale and hold it. Okay. Found our landmark. And again, take a nice deep breath in and hold it. Okay, so these are our two landmarks where the sound changes, and we are going to measure the distance between these, which should be between 3 and 5 centimeters, and could be as great as 7 or 8. So Sherry is 7 centimeters on this side, and as well she has 7 centimeters on this side, which she is symmetrical and within normal limits. The next thing we're going to do is auscultate the posterior chest. I will remove your pieces of tape. To do this, again, we have 9 landmarks on the posterior chest that we're going to listen to. I'm just going to grab my stethoscope. And Sherry, I just want you to take nice deep breaths in and out for me. Nice deep breath in. Great. Her lungs are clear to auscultation. No signs of crackles, wheezing, rhonchi, no adventitious lung sounds. So she's good to go with that. The last thing we're going to check is her anterior posterior to transverse diameter within normal limits. Her anterior posterior to her transverse is a 2-to-1 ratio. To do this, we're going to measure from the shoulder blades over. So we have 11, let's measure in centimeters. So we have 26 centimeters. To check her transverse, I'm going to have you lift your arm up to your ear and just hold it there. And we are going to go down the midclavicular line, and her transverse is 13 centimeters. So we indeed have a 2-to-1 ratio, which her AP is 26 centimeters and her transverse is 13, which is within normal limits. After that, that concludes our assessment of her respiratory system. Thank you.